My name is Karen Francis, and I'm doing my disability description on Fragile X syndrome. Fragile X is the most common inherited cause of mental impairment and the most common known cause of autism. 1 in 4,000 males and 1 in 6,000 females have been diagnosed with Fragile X. Some research suggests that there's a higher occurrence in African-derived races, as common as 1 in 2,500. The common features of Fragile X syndrome include mental impairment ranging from learning disabilities to mental retardation, attention deficit and hyperactivity disorder, anxiety and unstable mood, specifically social anxiety, speech and language disorders. There are unique speech and language disorders associated with Fragile X syndrome. Boys with Fragile X often have particular problems with pragmatics or conversational skills. Their speech and language are affected by physical, oral motor, attention, and behavioral characteristics. Girls with Fragile X often have many good verbal skills but have difficulty in pragmatic speech, with anxiety and shyness affecting their social interactions. Children and adults with Fragile X syndrome also have a tendency to be autistic. And in adulthood, it's not so evident in childhood, but in adulthood, they have a long face, large ears, flat feet, hyperextensible joints, especially fingers is a common trait of Fragile X, and epileptic seizures is also a common trait of Fragile X syndrome. It affects about 25% of those with Fragile X. Boys are more likely to be more severely affected. Most have mental retardation, while about 1/3 to 1/2 of girls exhibit significant intellectual impairment. About 20% of boys exhibit the features of autism as well. Fragile X has been linked to a gene mutation, a defect or a full mutation in the FMR1 gene shuts down the gene, preventing it from manufacturing the protein it usually does, therefore causing Fragile X. This gene is also on the X chromosome. The protein of the FMR gene serves the role of helping shape the connections between neurons that underlie learning and memory. Small defects in the gene or pre-mutations can cause others to be carriers while not exhibiting symptoms. Fragile X is an inherited syndrome. Male carriers pass the gene along to all their daughters, but none of their sons. 1 in 800 men are carriers of the Fragile X syndrome. Children of carrier women have a 50% chance of inheriting the gene defect. 1 in 259 women are carriers. The symptoms of boys, I guess it's explainable that the symptoms that boys exhibit of Fragile X are more severe because the mutation affects the only X chromosome that boys have. Girls intermittently transfer. I understand the X chromosome, one being defective, wouldn't necessarily present the same problems because they have another X chromosome. A female may not be as severely affected because each cell of her body needs to use only one of its 2 chromosomes and randomly inactivates the other. The testing used for Fragile X syndrome includes a DNA test which can accurately detect both carriers and those demonstrating full symptoms of the disease. While there is no known cure for Fragile X syndrome, some symptoms can be alleviated and learning potential maximized by medication. As with any learning disability or disorder, there are implications for families. Many children suffering from significant mental impairments can lead full, independent lives when they receive the correct treatment and services. Diagnosis of Fragile X does not automatically qualify a student for these services. Parents should have them evaluated for school services through the school, and depending on the symptoms, parents can expect to work with specialists, including educational specialists who will help identify the best and least restrictive learning environment, speech and language therapist, occupational therapist, physical therapist, and behavior therapist. Fragile X may present some challenges to families. Behavioral issues may limit some social activity due to the social anxiety children feel. Transitions are particularly difficult, but with the right preparation and patience, children and families can cope with these challenges. It's very important to present almost a plan to children during that time when you're transitioning, letting them know exactly what you expect, when you expect it, giving them advanced warnings, much the same as you would do with a child with attention deficit disorder. One example I saw was going through a church bulletin and showing the child exactly what would happen during a church service so that they know what to expect, they know what will be coming after what, and those types of techniques help the child or adult with Fragile X anticipate particular social situations and therefore reduce the social anxiety those patients feel. There are many sources out there to get information on Fragile X, some of which I consulted, but there are so many more that I couldn't get to.